deaths be higher than we actually know. We talked to coroners across the upstate who say they're following a strict protocol to make sure numbers are as accurate as possible. Coroners from different counties explained their process and how they've been swabbing for COVID-19. Fox Carolina's Kayla Conboy talked with them about what everyday life is like right now. And Kayla, what are they telling you tonight?
Well, much like the rest of the country, they are having to adapt and doing things a little bit differently, but most of them tell me they have a guideline, a list of things that they need to check for, so they're talking more with families to see what they need to test for. While the state begins to slow down adapting to a new home and work order, coroners are hoping their jobs also slow down.
We tease each other and think that we're going to rub the skin off our hands, washing our hands so much, but we're constantly doing that.
But still, the death toll is rising, although it might not be reflecting the true numbers. The U.S. Center for Disease Control and Prevention says only deaths confirmed by a lab test are added to the list.
What we try to do is to determine if indeed that patient meets the criteria to be tested for the COVID-19. And one of the things is whether or not there is an undiagnosed fever or undiagnosed respiratory distress.
But not every death possibly linked to the virus will present with those symptoms, which means not everyone is swabbed. Coroners have to be selective.
Others are evidence of direct exposure to somebody who has tested positive. So if they fit that criteria and they die outside of a medical facility, then we're going to try to do the necessary swabs and that sort of thing.
Coroners like Kent Dill from Greenville County say part of the problem is that they only investigate home deaths or deaths that didn't happen at the hospital.
Most of the deaths that have occurred in people who are already hospitalized.
Greg Shore with the Anderson County Coroner's Office confirms his office is handling things the same way by only testing those with symptoms or recent travel history.
We have had a couple that we have tested, both have been negative. The only positive cases we had have been in hospitalization cases, and those are the ones the hospital has reported to us.
Experts say a widespread lack of access and testing in the early weeks means some people died without being counted. And here on the home front, Kent Dill says while it can change the way they have meetings, the virus can't change the way they react when it comes to families.
We make death notifications face-to-face. When we do that, we try to be mindful because we don't want anybody to feel uncomfortable with us coming into their home.
Of the 4 coroners that I spoke to, all of them did confirm they are doing swab testing and say the test is very accurate even after death. Reporting live in Greenville County, Kayla Conboy, Fox Carolina, the 10 o'clock news.
Well, the